This PowerPoint contains question and answer about the pediatrics nursing for NCLEX board. These questions are board certified for NCLEX board exam. First question, a preschool age child refused to take ordered medication. Which nursing strategy is the most appropriate for them? If your baby do not want to take medication, then what nurse should do? Number one, mixturing the medication in milk so the child is not aware that it is there. Number two, explaining the medication's effect in details to ensure cooperation. Number three, making the child feel assumed for not cooperating. Also showing trust in the child's ability to cooperate even with the unpleasant procedure. So when your baby is ready to go to school or preschooler, this group is very important, right? So what are the answer? Number four, showing the trust in the child's ability to cooperate even with an unpleasant procedure. So we will not lie with the baby, right? Because children in this age group need to know the reality. Always we will be trustful to them. And this child or this age group need much physical activities. Also, they're moving from gross motor skill to fine motor skill. So rationale say to gain a preschooler cooperation, the most appropriate strategy is for the nurse to show the trust and express faith in the child's ability to cooperate even with an unpleasant procedure. Hiding the medication in milk may foster the mistrust. The nurse should provide simple, not details, explanation and should use the terms which the child can understand. So, because of our profession, healthcare provider, the first priority, make a trustable relationship with the patient. Next question. Preschooler age child refuse. Okay, no, this one. A mother brings her 8 months old son to the pediatrician. When the nurse approached to measure the child's vital sign, he go to the mother and touch the mother very tightly and start to cry. The mother says he used to smile at everyone. I do not know why he is acting this way. How should the nurse respond to the mother's statement? So 8 months old son, right? So this, when you go to read the pediatrics assessment in the milestone, you will learn more. Usually when baby is about the 8 months, they're very curious about the stranger. In this age group, they can sit without support. They pulls the standing position, but they fear to the stranger. This is important. So number one, your baby behave indicate stranger anxiety. which is a common at this age group. Number two, children who behave that way are developing shy personalities. Number three, children at this age begins to fear pain. Number four, you may be having a temper, right? And which is a common at this age group. The correct answer said, your baby behave indicate stranger anxiety, and that is very common in 8 months old child, right? Fear of stranger, rational. Stranger anxiety, common in infant age 6 to 8 months, may cause the child to cry, right? And also they turn away from the stranger because this age group baby like to play the game, like hide themselves or looking for themselves. Their parents has to look for them, so they like it. So typically, it occurs when the child starts to differentiate families or unfamiliar peoples. The child behavior does not necessarily indicate shyness. According to the theories, the fear of pain characterized the operational stage of development in the pre-age child, not to the infant. Okay. Temper are typically in older who are trying to assert their independency. Okay. So next question here. A 16 years old adolescent sustains a severe head injuries in a motor vehicle accident, and he is admitted to the neurological unit and subsequently developed neurogenic diabetes insipidus. Physicians ordered vasopressin 5 units subcutaneously twice per day. How long will the effect of vasopressin last? So key point here, your client is 16 years old, road traffic accident or motor vehicle accident, develop diabetes insipidus. It is not diabetes mellitus. And medication given vasopressin subcutaneously. So now vasopressin, how long work? Duration of work. So diabetes insipidus, a condition that results from an imbalance of water in the body. And this causes extreme thirstiness or frequency of excessive urination. So doctor gave vasopressin. So how long it work? Number one, 5 minutes. Number two, 30 minutes. Number three, 1 hour. And number four, 4 hours. The correct answer is 4 hours. Rational said the duration of action of vasopressin administered sub-Q, the duration of action 2 to 8 hours. So what we learn up to now? We learn diabetes insipidus is a neurological problem. It may be caused because of head injuries. And treatment is vasopressin. And we give vasopressin subcutaneously, and duration of action 2 to 8 hours. Here I'm going to compare and contrast diabetes mellitus and diabetes insipidus. So diabetes mellitus is a pancreatic problem. pancreas problem, but diabetes insipidus is a neurological problem. So they said it is the most common form of diabetes. Diabetes mellitus is the most common form, caused by the deficiency of pancreatic hormone, we so-called insulin, which result in a failure to metabolize. So pancreas maybe do not secrete insulin, or tissue do not know how to use the insulin. But diabetes insipidus is uncommon form of diabetes caused by a deficiency of pituitary hormone that causes the frequent urination. So here showing diabetes insipidus, the risk factor or patient give the history of head injury, pituitary tumor, or craniotomy. And pituitary secrete too much anti-diuretic hormone, so patient have too much urination. Specific gravity of urine go down, osmolarity go down, patient develop hypovolemia, increase the thirstiness, tachycardia, and drop blood pressure. So what are the nursing care? If your patient have a diabetes insipidus, we monitor the fluid level or replace the fluid. Neurological status we evaluate. Also, we evaluate the vital sign. Here showing compare, contrast, continue. Diabetes mellitus, pancreas problem. Maybe pancreas does not release insulin, or pancreas release insulin, but our body tissue cell does not utilize the insulin, or tissue is resistant to insulin, and blood sugar go level up. Patient develop diabetes mellitus. In case of diabetes insipidus, maybe the tumor or head injury and injured to the pituitary glands. And pituitary glands secrete too much antidiuretic hormone, right? Or pituitary glands produce insufficient ADHD. And diagnostic tests are recommended to rule out the other condition causes the similar symptoms. It is good to go, right? And now here, next question. A nurse plans a conference to discuss the care plan for an infant admitted to the hospital with a diagnosis of non-organic failure to thrive. Appropriate participant in the care conference include about what? Right? So this question about the failure to thrive, and this is the non-organic cause. Hospital call a meeting or make a team. Who will the member of this team? Number one, registered nurse, physician, social worker, and infant parents. We call caregiver. But we do not know parents is a first caregiver or not. Maybe parents is too busy. They hire someone as a primary caregiver. Number two, social worker. RN, occupational therapy, but is a non-organic. So do we need the occupational therapist? We definitely know. Infant primary caregiver, RN, physician, occupational therapist. Number 4, registered dietitian, RN, and physician, infant primary caregiver. So correct answer is number 4. So as I told primary caregiver, it is not mandatory parents. Parents may be the primary caregiver, but we have to make sure who is the primary caregiver, who take care of the patient. Occupational therapy do not need because it is a non-organic, no organic cause, right? And social worker, we do not go because there are no sign of abuse. So failure to thrive, this may include medical condition that are either undiagnosed or previously diagnosed. We have to evaluate first. Then we decide what should do, right? Sometimes children are diagnosed with the failure to thrive when their weight or rate of weight gain is significantly below that of other children of similar age and sex. Very important. Rationale. The registered dietitian, RN, physician, infant primary caregiver are crucial interdisciplinary team members who should participate in the care for parents. The dietitian can address nutritional needs. The primary caregiver can provide input. The social worker and occupational therapist may become involved after the infant condition improves, but they are not the crucial member of the team at this point. Infant or children that fail to thrive seems to be dramatically similar or shorter than the other children in the same age group. Teenagers may have a short stature or appears to lack of usual change that occur at puberty. So it indicates their growth stop or failure to thrive. The next question, a nurse is caring for 2.5-year-old child with a tetralogy of Fallacy. So which abnormalities associated with tetralogy of Fallacy, right? So tetralogy of Fallacy, a congenital heart condition presenting a combination of 4 defects in the structure of the heart. The most common symptom is blue color of the skin in the newborn. As I told you, heart condition presenting a combination of 4 defects. So we have to find out from here who they are. Number 1, aortic stenosis, atrial septal defect, overriding aorta, left ventricular hypertrophy. Number 2, pulmonic stenosis, intraventricular septal defect, overriding aorta, and right ventricular hypertrophy. Number 3, pulmonic stenosis and patent ductus arteriosus, overriding aorta, right ventricular hypertrophy. And number 4, transposition of the great vessels, intraventricular septal defect, right ventricular hypertrophy, and patent ductus arteriosus. Which 4 defect in the structure of the heart, so-called tetralogy of Fallacy? Number 2, there are 4 diseases, right? Pulmonary stenosis. This is the pulmonary stenosis. Right ventricular hypertrophy. This ventricle, this is the right ventricular hypertrophy, overriding aorta, and ventricular septal defect. This picture we can compare with the normal heart. So right ventricular hypertrophy, normal heart, this is the right ventricle, but it is hypertrophy occur here. And you see, this is the ventricle, this is the aorta, but opening in between aorta and ventricle. So oxygenated blood will mix the deoxygenated blood, right? And pulmonary stenosis here. Also, pulmonary stenosis here and overriding aorta. There are 4 signs together we call Tetralogy of Fallacy. So rational say TOF consists of 4 congenital anomaly: pulmonary stenosis, intraventricular septal defect, overriding aorta, and right ventricular hypertrophy. The other combination of defects are not the character of Tetralogy of Fallacy. So if unfortunate baby born with the Tetralogy of Fallacy, usually they have a bluish coloration of the skin due to the reduced amount of oxygen to the blood, difficulty in the breathing or shortness of breath, growth of the skin or bones around the fingernails, or we call clubbing developed, poor weight gain, loss of consciousness, problem with eating, prolonged crying, developmental delay. This is a common sign of Tetralogy of Fallacy. Next question. A nurse is teaching a mother of infant. The nurse should instruct the mother to introduce her infant to solid food at what age group? So when is the good time mother should give to baby solid food? Number 1, at 2 months, at 4 months, at 6 months, or at 8 months. So when should you give your baby a solid food? So breast milk or formula is the only food your newborn needs, right? And American Academy of Pediatrics recommended excessive breastfeeding for first 6 months. So, right, first 6 months after birth. But by the age 4 months to 6 months, most baby are ready to begin eating solid food as a complement to the breastfeeding or formula feeding. The correct answer is 6 months. Here the rationale. Solid food are typically introduced around age of 6 months, and they are not recommended at an early age because of protrusion and sun sucking reflex and the immaturities of infant GI tract or immune systems. By age 8 months, the infant usually has been introduced to iron fortified infant cereal and vegetables and will begins to try the foods. So here a list the food for baby for 4 to 6 months. What are the good food? Cereal or grains like rice, barley, oat, some fruits, avocado, apple, banana, peas, vegetables, yeah, sweet potato, green beans, protein, none, dairy, none. So let me recap it one more time. Solid food typically introduced around 6 months, right? But American Academy of Pediatricians recommended exclusive breastfeed for first 6 months after the birth. But by the age of 4 months to 6 months, most baby are ready to start eating solid food as a complement of breastfeeding or formula food. Next question. Which sign is an early indicator of heart failure in an infant with a congenital heart defect? Right? So there are 4 options. Which one you prefer if baby have a heart failure? Trachypnea, tachycardia, poor weight gain, and pulmonary edema. Right? Early sign of heart failure. So correct answer is the trachycardia. So the earliest sign of the heart failure in infant is tachycardia, means when heartbeat or heart rate greater than 160 beats per minute. We are talking about the infant, not an adult. As a direct result of symptomatic stimulation, tachypnea means respiratory rate greater than 60 beats per minute in infant. Occur later in response to decrease the lung compliance. The poor weight gain is a result of increase the early demand to the heart and breathing effort, not an early sign of the heart failure itself. The pulmonary edema occurred as the left ventricle failed. The blood volume and pressure increase in left atria, pulmonary vein, and lungs. It is not an early sign of heart failure. So in this picture, you can see acute right side heart failure and acute left side heart failure. So right side heart failure, like here, we said, right side heart failure or right ventricular heart failure, which sometimes called, usually occur as a result of left side heart failure. So if anybody has a left side heart failure, it leads to right side heart failure. And both can lead to congestive heart failure. So when the left ventricle fail, increase the fluid pressure is or in effect or transfer the back through the lungs, ultimately damaged the heart right side. When the right side loses the pumping power, blood backs up to the body veins. So usually right side heart failure patient has a loss of appetite, right side, blood go to the back flow to the right side in superior vena cava, inferior vena cava. So patient has a congestion of the liver, patient has a leg edema, weight gain. But when the left side heart failure means left ventricle, blood go backflow to the lungs, shortness of breath. Upright respiration position is good, shortness of breath and cough at night, palpitations, fatigue, and easily get tired. So here we go. So there are two primary causes of heart failure in the children or adolescents. The first is overt circulatory failure, or occur when blood mixed inside the heart due to the congenital heart failure problem. Whatever, if right side heart failure, congestion of the peripheral tissue, edema and ascites, liver congestion, impaired liver function, GI congestion, anorexia, GI distress, weight loss. When left side heart failure, decrease the cardiac output and blood go back flow, enter into the lungs. Pulmonary congestion, but here is the liver congestion. Activity intolerance, sign of decrease the tissue perfusion. Cyanosis means lack of oxygen to the tissue, hypoxia. Patient develop orthopnea. When they lie down, shortness of breath, cough, and also paroxysmal nocturnal dyspnea. So cough at the night time. Next question, a 10-year-old child visit the pediatrician office for his annual physical examination. When the nurse asks how he is doing, he becomes very quiet and state that his grandmother passed away last week. The child this age is likely to make what statement about the concept of death? Select all. So at 10 years old, at 10 years old, most children begins to understand that death is a universal process. It is irreversible and non-functional state. So meaning that death cannot do the things that a living can do, right? So at the age of 10 years old, you have to know this. So correct answer is, once you die, you never come back. It is the universal truth. It is irreversible. Number 3, my grandmother's death has been hard to understand. It is reality, right? And my grandfather died because she was sick and nothing could make her better. Unfunctional state. So who die or death, beings cannot do the things that living can do. Rational, by age of 10, most children that death is irreversible and find out. However, a child may still have difficulty to understand the specific death of a loved one. School-age children should be able to identify cause and effect relationship. such as when a terminal illness causes someone to die. They can understand it. In adolescence, not the school-age children understand that death is a universal process. The preschooler see the death as a temporary and may think of death as a punishment. Next question here about the shock. So a preschooler child present with the history of vomiting and diarrhea for 2 days, which assessment finding indicate that the child is in the late stage of shock. So 2 days, if you have vomiting and diarrhea, so fluid loss through the upper part of GIT, fluid loss through the lower part of GIT, volume go down, hypovolemia developed, which is lead to the hypotension, and hypotension lead to the shock. So what are the common symptoms of shock? Tachycardia, bradycardia, irritabilities, or urine output 1 to 2 ml per kg per hour. What is correct answer? Bradycardia. So rational said, bradycardia is a sign of late shock in the child. Cardiovascular dysfunction and impairment of cellular function lead to lower the perfusion pressure, increase the pre-capillary arterial resistance and venous capacitance, decrease the cardiac output, occur in late shock if the circulating volume is not replaced. Sympathetic venous innervation has limited compensation mechanism if the volume is not replaced. Tachycardia and irritability occur during the early phase of shock as a compensatory mechanism are implemented to increase the cardiac output. The normal pediatrics urine output should be 1 to 2 ml per kg per hour. Volume less than this would indicate a decrease the renal perfusion and activities of the renin, angiotensin aldosterone systems to decrease the water and sodium excretion. So if you ask me what is shock, the shock is a critical condition that brought on by a sudden drop in blood flow through the body, and the circulatory system fails or fails to maintain adequate blood flow, or sharply hypovolemia developed, right? Or decrease the delivery of oxygen, nutrition to the vital organ. And it also compromised the kidneys and so restrict the removal of the waste product from the body. Here we can see what are the early sign of shock and what are the late sign of the shock. So blood pressure at the beginning it's normal, but then it's go down, drop, decrease the blood pressure 90 minutes of mercury in systolic. Blood pressure down lead to the cardiac output down, that lead to the cardiogenic shock. What else? Pulse rate go up, right? So develop the tachypnea, okay, at the beginning. The skin color normal, but later on pale because deficiency of oxygen to the tissue. And then body temperature, cold, moist, but late stage cold. Patient develop anxiety. If you do not replace the fluid, hypovolemia lead to the shock and shock lead to the coma. If you check the respiratory rate at the early increase, the rate increase the depth. The late stage increase the rate, but it should be shallow. So shock is defined as a condition where the tissue in the body do not receive enough oxygen and nutrition to allow the cell to the function. And shock ultimately leads to the death if you not treat it. Here we discuss few board review questions. It will help you to make your license.